top story, new findings about a toxic landfill in Bridgeton.
This validates everything that we went through.
The improvements made and the fears those living nearby still have. We want to thank you for joining us at 10. I'm Brent Solomon. Mike and Ann have the night off. Tonight, the Missouri Department of Health says fumes from an underground fire at the Bridgeton Landfill are now at safe levels. But that wasn't always the case. The fire still burns today, just yards away from radioactive waste buried in the neighboring West Lake Landfill. 5 on your side's Laura Bercheski joins us now. Laura, you spoke with those who fought for years to clean up that landfill.
I did, Brent. The people I talked to who were affected by the fumes from this landfill say this report affirmed everything they were going through years ago with nosebleeds and health problems. But for them, this isn't over, and there's still a long way to go to make this area safe.
Well, I mean, I think we've lived through it, right? I mean, we were the ones that were at Target shopping and encountered the odor, and then the nose would start bleeding.
For years, the families and workers around Bridgeton Landfill and the West Lake Landfill site as a whole couldn't escape the fumes and odor from an underground fire.
It was coming in our windows. I mean, we'd have to shut off our HVAC systems at points.
In 2014, a new gas and leachate extraction system was put in place to control the sickening sulfur-based odor. Now a report from the Missouri Department of Health says those measures reduced emissions and dropped the health and cancer risks down to a level that's similar to living in a city. But Dawn Chapman says those findings are not 100% reliable.
The system did go down when it flooded a couple weeks ago. So for that, you know, and then they rushed to get it back on. But yeah, if it doesn't work, then it comes back.
The report says in years prior to putting in that system, the health and quality of life of people who worked and lived near it were harmed by those odors.
You know, the number of people that had not had issues before, that suddenly that was happening. You know, they were having lung issues and then it was cardiac.
But unfortunately, there were some unknown chemicals in the air they couldn't really study, according to the report.
And it's also a concern in the future. I mean, if we were able to create new chemicals just from old chemicals mixing together, then how do we know that there aren't other things mixing in and the creation of something else that's even more hazardous?
And while the extensive monitoring done by the state is largely over, the people affected by the issue continue to dig through data.
Right now, it's kind of like a patient in critical condition, right? It's hooked up to wires. It could crash at any time. You know, we are looking for the ultimate surgery, the ultimate fix, and things that will make it stabilized.
The residents I talked to say they would really like to see the air quality monitoring continue at the level it did during this study, and hope in the future leaders will be more transparent with them. Brent.
All right, Laura, thanks.